We have to rethink the way we address Ebola infection control because even a single infection is unacceptable.
I'm Amy Holmes, bringing you the Hotlist at the Blaze. That was CDC Director Thomas Frieden taking a more measured tone in the wake of news that despite wearing head-to-toe protective gear, Dallas nurse Nina Pham, who helped care for Ebola victim Thomas Eric Duncan, has contracted the potentially deadly virus. Well, here in the United States, disease epidemics have been mercifully rare, but when they do happen, they're devastating. As Healthline.com reports, the very first epidemic on American soil was smallpox in 1633. The disease brought by European settlers swept through the Northeast, wiping out nearly 70% of the Native American population living there. The last case of smallpox in the U.S. was in 1949. In the mid-1800s, a worldwide cholera epidemic hit the Mormon and Oregon trails, killing 150,000 people from the East Coast to the West. And in the 20th century, the Spanish flu, which actually began with U.S. troops training right here in America, killed 675,000 Americans in just months and 20 million people worldwide. When it comes to quarantines and restricted travel, the polio epidemic of the 40s and 50s led to health officials restricting travel between U.S. cities. Even entire towns were quarantined to keep the virus from spreading. And in the modern era, HIV/AIDS has killed over 636,000 Americans since the epidemic was first recognized in 1981. 1.1 million Americans are currently living with the infection, and 1 in 6 don't even know it. Well, hopefully past experience with disease epidemics here in the United States will lead to current lessons and successful prevention. We're all depending on it. I'm Amy Holmes reporting to you from the Blaze Newsroom in New York City.